Then we've got our surgery section, and I want to talk about those long op reports a little bit. And I've got a handout for you. And, okay, this is the coding for operative reports handout. These can be, and I know they're overwhelming. You just have this whole page of words, and it's like, what is this? Okay? And I can send you an electronic copy if you want that too, but, okay. So op reports can look a little bit different, but they're all basically gonna say the same thing. And this outlines that you can read, I don't need to read it to you. But here's what you're gonna look for. Here's what I want, here's how I recommend approaching looking at those big op reports, because they are terrifying. I know. Okay. I want you to start this way. I want you, it's probably gonna say, for the most part, something like this. Your pre-op diagnosis, your post-op diagnosis, and then procedure performed. It's gonna have a diagnosis and it's gonna have a procedure, right? Okay, so like if you look on this fourth page, I didn't paginate this, but if you look like on this fourth page, I've got preoperative diagnosis, questionable recurrent basal cell carcinoma frontal scalp. Postoperative diagnosis, benign lesion, frontal scalp. So you see how that stands on the third page. I lied. It's on the third page. Okay. For your diagnosis code, you're going to always code the post-operative diagnosis, because now we know what it is. Because I don't code any, I always code the most definitive diagnosis I have, right? Okay? So, a lot of times they're the same though, right? It'll say pre-op diagnosis and post-op diagnosis, and it's the same. That's fine, who cares? But if they're different, use the post-op. Okay? Then, this says operation. Biopsy of granulating area with electrode desiccation. Yikes, a possible recurrent basal cell carcinoma of the frontal scalp. Before you read anything else, before you touch it, I want you to go to CPT. This says biopsy of granulating area with electrode desiccation. Why did I pick such a hard word? Of possible recurrent basal cell carcinoma of the frontal scalp. So, probably I would go to biopsy first. I don't even know. That's probably, I mean, I know there's a lot in biopsy, but that's probably the easiest way to approach that. All right, so we've got scalp, which is skin. Let's see if it says scalp first, just for fun. No, it does not. Let's see. Let's see, skin. Okay. Here's the funny thing about skin. Integumentary coding is a lot trickier than you'd think it would be. But you know what? Your skin's your largest organ. It covers your whole body. And when you have a superficial thing done to you, it's usually coded skin. But if they get into the deep tissue, it's coded from the musculoskeletal system. So say if they were doing a biopsy on my nose, but it was just, it's the skin of my nose, right? But if they have to go in there, it's going to be nose. It's going to be in a nasal. Okay?
But if they don't, it would just be skin.
Yeah. Okay. That's why if I'm coding for like repair of abrasion on my, say a laceration on my leg, you don't want to go to leg, you want to go to skin. Because it's the skin on my leg.
Would it be under skin lesion?
Yeah. Huh?
Would it be under skin lesion?
Probably. I think that's where I would start, is that skin lesion. So, I lost it now. So we got 11100 with 11101. So let's see what that says. All right. So there's some notes under biopsy, so it's important to always read those. Okay, so we're going to 11100 up front. Let's see. So just to kind of sum it up, it's just important to read these one before you use the codes. It kind of explains what a biopsy is. It says if it happens during a surgical procedure, you don't code for it separately. Okay? So like, say for example, if I was getting colonoscopy, right? And they're taking those samples out, if they see something funky, it's kind of bundled in with that. Okay? It says, the use of a biopsy procedure code 11100 and 11101 indicates the procedure to obtain the tissue for a pathologic examination was performed independently or was unrelated or distinct. That's saying if this is the only thing you did, you can use these codes. Okay? Such biopsies are not considered components of other procedures, blah, blah, blah. So you see how it's telling you how to use the codes. So for 11100, it says biopsy of skin, subcutaneous tissue, and or mucous membrane, including simple closure. That's telling me that stitching me up after my biopsy is included, unless otherwise listed, single lesion. Then you see it says 11101 with a plus sign next to it. Remember I said those are add-on codes, they can't be used by themselves, so that means each additional lesion. So say I had 4 lesions they were going to remove, right? It's going to look like this. This goes back to that units thing. There's my first lesion, right? They did 4. So my units is 1, and then 11101. Oh, okay. All right. I don't know if that's right for me. So, here, and I know, because I haven't read the op report yet. Okay? Now, if this doesn't say anything about that electrode desiccation, I don't know. Is that important? I don't know. All right? Let's see. So at that point, then you're going to go through. Once you kind of have some ideas, right? Well, this might be it. I might need to go back and dig around some more. I've got 5. I've got a range of 5 codes. Now I want you to go read the op report and look for clues. Okay? Like this person was put under, right? Let's see. Patient was placed in the dorsal recumbent position. So look at the position. That's usually, sometimes that matters, sometimes it doesn't. I want to know kind of the area. It's on the scalp. Oh no, they didn't put him under. They just used xylocaine. So they put the patient there. They draped him, right? I really don't care that they use topical anesthesia. I don't care at all. I can ignore that. Okay, if it was general, and it would even depend because, you know, I'm probably just coding for the surgeon here anyway. Okay. Let's see. Then it says how they excised it. I don't really care about that either. Hemostasis, well, they got him to stop bleeding. Hooray for him. Then the entire area of granulating tissue was electrode desiccated. Then they've got the size of the specimen. Sometimes that's important. And then they just got all that junk out of there. It's pretty straightforward. Okay. So this could be, the only thing I'm concerned about is that word electrode desiccation. I'm not seeing that anywhere here. You know what I mean? I don't know if it's important or not, but I'm going to come back here and look and see if there's anything under that. You know what I mean? There may not be.
finish it? Did you have it?
I did.
Okay. Yes, you
I was
would.
right.
Okay, so electrode desiccation, those are not the same codes we've been looking at, is there? And here's why. I mean, this is obviously, if they're doing this via this method, it's more involved, isn't it? And it probably costs more. And if I just code for a simple biopsy, that might as well just be a punch biopsy off my nose. You know, which I've had that. Smarted. Really did. Big chunk right out of my nose. All right. make sure eyes water. 17000 to 17286. Would you read this to me? I'm gonna write it down. 17000. Yep. To what?
17286.
Okay, now we've got new one. Let's go look at those. Because I'm feeling like this might be a bit more representative of what we need.
Okay.
Okay, let's see. No. Ooh, kinda, I don't know.
Let's see. Close to that is electrosurgery.
Yeah, I'm saying that, I think that, since the index took us here, I'm feeling okay about it. Because that did say electrode desiccation or whatever in the
Yeah.
index, so I'm feeling okay about that. Okay, so, let's see. Let's see, after the entire area, after the entire area was thoroughly desiccated, there's how big it is. Part of the specimen is a partly nodular hemorrhagic lesion measuring 0.3 centimeters in diameter. I don't think that matters so much. If you flip where it says malignant lesions, it gives diameters for those, but this isn't malignant because it says benign, right?
Right.
Okay. Right. It's not pre-malignant, that 17000 says pre-malignant, right? 17004 also says pre-malignant 15 or more lesions, which we know that's not right. 17106, destruction of cutaneous vascular proliferative lesions. That would be like a blood vessel-y thing. This is just granulated tissue, right? Vascular, right? Then it says, what have we got? 17250, chemical cauterization of granulation tissue. Okay. I'm going to read my notes over here. Under destruction means destroyed, right? They took it all out. It's not like a little biopsy where there's a ding, they take a little piece. Okay, destruction means it's gone. Okay? All right. So, here's my thoughts on this one, and I'm going to explain my rationale to you. Probably, I would go with 17110. It says destruction, laser surgery, electrosurgery, blah, 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 of benign lesions other than skin tags or cutaneous vascular proliferative lesions up to 14 lesions. Here's why I would probably pick that one. A, remember the biopsy code said if that biopsy is part of a larger procedure, you don't code for it. Remember it said that, right? They took that whole thing out. This is obviously a larger procedure, right?
Yeah.
Because they did that electrosurgery. They took it all out, okay? And that 17250 does say granulation tissue, but it says chemical cauterization, and that's not what this is. I like the word granulating. But but we didn't do a chemical cauterization, we did electrosurgery. That's probably a tougher example than it needed to be. But do you see what I did there? I started with my basic idea, then I found what those codes were, then I read the report. And then I said, oh, I don't think that's quite right, but here's a word I might go look at. Okay? Does that make sense? I know they're overwhelming. I know they are. So this kind of outlines for you keywords to look for, your steps once again, okay? Your keyword to look for, simple versus complicated, unilateral, bilateral, incision versus excision, okay? Open and closed surgery, especially if you're dealing with fractures, you want to be careful, okay? Because in this book, in ICD, open and closed fracture means what? What's an open fracture diagnostically? That my bone's sticking out, right? Okay, yeah, Louis is right. Okay. Closed fracture means my bone is not sticking out. Okay, that's probably preferable. All right, now, but when I'm talking about CPT, open versus closed, means open or closed treatment. I can have a closed fracture with open treatment, right? Because they can do surgery on it.
Okay.
Okay? So I can have open treatment of a closed fracture. I can also have closed treatment, like the example we looked at with manipulation or without manipulation, that clavicle fracture, okay? I know, but it might just be broken enough, they can just be like, okay, we're just gonna do this for you, and then you're good. But if they might just go like that, closed, which I would hope I'd have really good drugs to do that with. But they just go, and that's closed treatment with manipulation. They're manipulating that bone back where it was. Yeah. Yeah. They do give you good drugs for that.
But you still sprain.
I know, I was afraid too. I read about those old folks coming in, they use those close manipulation of hips and stuff. It's just
Oh, man.
Actually, a lot of people like traction when they have a broken bone.
Uh-huh.
They think, I don't understand, I've never had traction.
I never have either. I've broken bones before, but
But traction.
Not that badly.
You put weights on it and you pull on it while they're still awake. A lot of people like it. They like it. Besides me.
me too. You want to look at things like, was there a biopsy done? You want to look at the method, make sure that, if it's a laparoscopic procedure, you're coding it laparoscopic, because you might go to appendectomy. Well, there's different ways to take your appendix out. They can cut into you and take it out, but they usually do it laparoscopically. Okay, so they just poke the little holes in you and go in there and suck it out. That doesn't hurt that bad. I don't know.
You don't think it hurts?
I don't know. I still have my appendix. All right. Was there debridement done? So debridement, they're cleaning that wound thoroughly. They're flushing. Maybe I bit it on my motorcycle. There's foreign materials in there, or necrotic tissue or something like that they have to debride out of there. Reconstruction, watch for things like grafts, because that probably means you need another code. Okay? So one surgery can have more than one CPT code if they did a bone graft or a skin graft or something like that on top of it. If it's not included in that code descriptor, think about if you maybe need more codes. Okay? And plus that practice, it tells you how many codes you need. The real world does not, but. Okay. Then, feel free to underline when you're doing, especially when you're taking your tests, as you're reading those op reports, underline those terms you think are important. If it gives a measurement, underline it. Okay? If the wound was this long, it may not be important, but you don't want to have to dig for that again. So underline those words. And then, here's the words you can kind of ignore. Things like minor, simple, when they're opening them up, closing them up, that kind of thing. Okay? It doesn't matter that much. It does for clinically, but it doesn't coding world. Okay? This is kind of an important note right here. at the bottom of this page, it says, never assign a code described as a separate procedure when it's performed within the same incision of a primary procedure or as part of a greater procedure. So what you're gonna see are those little, you might even see like when you're looking at a little parenthetical note, it says separate procedure. It means you only code that if that's all they did. If it was part of a bigger thing, you don't code it. Okay? All right? It's all in the book. It's not all just in my head, because I promise you, these guidelines explain right here what a separate procedure means. Okay? All right, so it's in here. Talks about the surgical package, all that good stuff. The best thing for us to do is just do some. We're going to do it real quick. I'm going to walk through E&M really, really fast, just to kind of refresh your memory, okay? And then we're going to take a look at some sample questions because it's starting to get late.